How to stay healthy in the Wiregrass. Amazing new information on wellness from professionals. Your Wellness Network.
Capsule endoscopy is a way to evaluate the small intestines. Frequently we do upper endoscopy and colonoscopy, but that excludes a portion of the bowel, approximately 20 feet of the bowel that's previously been difficult to evaluate. Capsule endoscopy is a way to evaluate that portion of the bowel by swallowing a pill that's about the size of a large multivitamin. The patient would be asked to wear a belt, and the capsule transmits the pictures to the belt where they're stored and recorded. The patient brings the belt back. We're able to download those images and review them just as though we were doing the actual procedure in the procedure suite. The indications for capsule endoscopy include patients who have been evaluated with both upper and lower endoscopy, and we're searching for obscure GI bleeding. The patient's having gastrointestinal bleeding. We've been unable to locate the source by standard endoscopy. Frequently we'll be able to localize the bleeding and identify the source and provide recommendations for therapy based on the capsule endoscopy. People who have inflammatory bowel disease, this allows us to assess their disease activity as well. Patients who have a history of polyposis syndrome or who are at risk for small bowel polyps, we use capsule endoscopy to evaluate those situations as well. One of the more recent uses of capsule endoscopy has been in the diagnosis of celiac sprue, which is an ever-increasing diagnosis these days. The risks of capsule endoscopy are very low. We tell patients there's a small risk, approximately 1% of capsule retention, which means the capsule becoming stuck. That is more common in people who've had multiple abdominal surgeries or people who have inflammatory bowel disease such as Crohn's disease. If the capsule does become lodged, we recommend a repeat x-ray in approximately 2 weeks to document that the capsule has passed unless the patient has noted that it passed. When a patient has a capsule endoscopy, following the completion of the exam, which it records for approximately 8 hours, they will bring the belt that contains the computer, and we download those results. The physician will then review those results. It can take anywhere from a week to a couple of weeks to get those results back to the patient and the referring physician. If you have any further questions about your digestive health or wish to schedule an appointment with us, please visit our website at www.digestivepros.com, or you can call our office at 836-1212. We currently have offices seeing patients in Enterprise, Dothan, and Ozark.
Your Wellness Network, presented by Digestive Health Specialists.